welcome to Round Robin. I'm Celine Guerrero with the City of Hampton, and with us today we have Shannon Pigford of the Health Department. Welcome, Shannon.
Thank you, thank you.
So what is your role at the Health Department? And it is a very important role.
Well, I serve as a public health nurse, and my position is the child care health consultant. So I go out and I teach and interact with all of the local daycare centers here in the City of Hampton.
And when you say interact, how are you interacting? Are you training? Are you certifying child care providers? Or
Both. So I do all of their certification trainings required by Department of Social Services for their licensure. I also do in-services, go in and visit during staff meetings. I do observations to see if they are maintaining the standards of child care development.
Okay, now, and these are for local, is this in-home cares, privately owned, your big name child care and daycare facilities?
Well, I work in alliance with some of the larger child care centers because a lot of them do have nurses on staff already, but I do most of my consultations with, yes, the family day homes, the private daycare centers, child development centers, learning centers, but most of the larger corporate ones, again, I just work alongside.
Okay. Now, from a parent standpoint, because like many other parents with small children, you have to decide, hey, it's time, for me to go back to work, or, a situation has changed. We need childcare. We need to put our infant, our toddler, our school-age child in childcare daycare. So many times we go on all these tours of different facilities, or we call different in-home cares. But my biggest thing has always been, what am I asking for? What do we as parents need to look out for as far as certifications and training?
Sure. Well, one of the most important trainings I would definitely say would be your CPR and first aid. You want to make sure that there's always that you have someone in the building who is always CPR certified at all times, and can the building accommodate that? Is it more than one person on their staff that is CPR certified? So in case one is out, do they have another person who would be able to fill in that void? There are other certifications such as MAT certifications, which are trainings that you need for administering medication in the daycare center. So if you have a child who needs medication, that could be an EpiPen, it could be an asthma pump, any form of medication, they have to be certified to administer that medication. So that's another one that you want to ask. And that's MAT for medication administration. And then there are other courses that we teach that keep the daycare providers abreast of the communicable diseases that are in the active in child care centers, from the flu and stomach viruses and strep, and just making sure that they know how to recognize what, those signs and symptoms, and when is it appropriate to notify a parent.
Right, and I guess that would also fall into possibly the MAT portion would fall into like maybe food allergies as well? Or?
Correct, correct. Those things are addressed in MAT trainings, and we do offer other trainings that we talk about allergies and what to be aware of, and ways to incorporate allergy-friendly foods into the programs.
Okay, and now as a parent, let's say they do tell me that they do have these certifications, or is there a way for us to confirm with the health department? Can we call and say, is this child care, been?
Well, all this, it's not necessarily the health department, it would be our Virginia Department of Social Services. They list all of our daycare centers and their licensure status, whether or not licensing has ever been revoked or placed on probation, things of that sort. You can find out the status of their, whether the license is in good standing.
And is this something that can be found online?
Yes, it will be online at the Virginia Department of Social, VDSS.gov, VDSS.gov.
Okay. Yeah, that's great, because that would be a great reference for parents and, caretakers, a guardian or someone who is looking for child care and daycare services. And now you see a sign, free daycare, or is there, you always want to go with the lower end because it's affordable. as opposed to the higher end. Is there now a difference, as far as like
No,
certifications go?
no, it's really not. It's really not. Some of the more like the in-home daycare centers that are daycare providers that are have that more homely feel to it, kind of run by a family.
Right.
You can get good quality care as you would at some of the more larger scale child care centers as well. As long as everybody is all following the standards
Right.
accordingly, price rise really wouldn't matter.
Right.
It
And
shouldn't.
would you be able to speak on whether, there'd be any red flags that maybe parents should be aware of?
Well, I would definitely want to say, drop by, visit, ask if you can come by at random times. You want to visit during times of transition, not visit only when children are sitting down at the table or sitting down during center time. You might want to go drop in at a lunchtime or as you see the recess times and, to kind of get a feel for, are the children being cared for? Are they being watched after? Are they getting the attention that they're supposed to?
Right, right. And that is very important. And, going in, you kind of go a little bit hyper aware. I know for myself, my son was in in-home childcare. And the only reason I was really comfortable was because they came recommended through a friend. But I did go and I did visit with them at first, and then I asked if I could do maybe an hour or two to start off and to see how he reacted and how he adjusted. And of course, there is always that crying at drop off, and it tugs at your heart and you walk away hoping that they did stop. They're very good about sending me a text or a picture of him playing and happy about 20 minutes after I had gone.
Right. And that's most of the cases anyway.
Right.
It's
So,
just,
well, thank you so much, Shannon. Is there anything else that you want to add?
no, I think that's all.
Okay, yeah, but I mean, what you do though, it is important that we all understand that these trainings and certifications do exist, and the health department is helping keep all of our childcare and daycare facilities safe.
Yes.
And our parents could go in and leave their children and know
Feel
that they are
comfortable
right.
Here in Hampton, they are getting the trainings that they need.
Exactly. Thank you again, Shannon.
Thank you.
And thank you so much for watching.